Hi, I'm Dr. Radhakrishna. When we look at the current anti-epileptic drugs, they work through ion channel modulation, enhancements of GABAergic inhibition, glutamate receptor modulation, calcium channel modulation, neurotransmitter balance, neuronal stability or stabilization, and anti-inflammatory effect. In in addition to these, RK0 and RK Restore has an added benefits to the current methodology of treating epilepsy using epileptic drugs. Hi, I'm Dr. Radha here, Dr. Radha Krishna. So if we look into a brain insult, it could be status epilepticus, stroke, trauma to the brain injury, childhood febrile fits, or hypoxic damage. Okay, all have a common outcome. That means there's a massive release of free radicals. These radicals, free radicals, cause an increase in the cytosolic calcium, and it causes an overstimulation of calcium signaling pathways. This calcium signaling pathways is like VGCC. VGCC stands for voltage generated calcium channels, and that massive amount of overstimulation will cause a mitochondrial dysfunction, and that causes an increased amount of ATP and then energy depletion, and the cycle continues. That causes cell damage. This cell damage directly and indirectly causes hyperexcitability and causes seizure. So in other conditions like massive amount of toxic metals or massive amount of chemicals, also high amount of inflammation that is going on in the brain also can cause seizure, which are to be tested in other methodologies to understand how we can view these particular external indicators that may cause seizure too. So what did RK Restore specifically did for help to overcome seizure? By number one, it helps to remove the root cause. The root cause can be massive inflammation. This inflammation is secondary to a primary, and it has also removed free radicals. As a result, it reduces the overstimulation and it has corrected the mitochondrial dysfunction. And so the number one function of RK Restore is that it has crossed into the blood-brain barrier, corrected the mitochondrial dysfunction, removed the free radical. It also corrected the GABA glutamine pathways or GABA and adrenergic imbalance, and it has overcome the inhibition. It corrects the calcium channels, so it corrects the neurotransmitters and is a powerful anti-inflammatory. While the RK0 acts on cytokines, which is the inflammatory pathways like interleukin 1, interleukin 6, tumor necrotic factor, causing massive inflammation. On top of it, it also corrects the cannabinoid pathway in the brain, especially the CBD1, where it's able to modulate the calcium channels. And a combination of RK0 and RK Restore over a period of time is able to either reduce the number of seizures or totally stop the seizures over a period of between a month to 3 months of management. Dr. Radhakrishna signing off.